Reopening is certainly the theme around our state. Well, hospitals never closed throughout the pandemic. They just learned some new safety measures. And joining us to talk more about that is Jeffrey Flaks, President and CEO of Hartford HealthCare. Thank you for being with us again.
Oh, my pleasure. Good afternoon, Lisa.
Good afternoon. So as the state reopens, how safe are hospitals at this point?
Well, as you said, hospitals never closed. And I'm so proud if you really think back to the way hospitals have stood up to the challenge during this process. We had to change everything we did to take care of COVID-19 patients and make that our highest level priority. But at the same time, we had to maintain our critical access services and take care of people with heart attacks and strokes and trauma, and people continued to deliver babies. But over the last few weeks, we've now started reintroducing all of our essential services, all of our elective surgeries, and we're doing it with remarkable attention to being careful, safe, and with the highest levels of quality.
All right, so as we flatten the curve, how have hospitals emerged from the pandemic? What's the new normal when it comes to the delivery of health care?
Well, it's interesting, Lisa. People keep talking about the need to return to normal and the desire to return to normal. And I get that in so many aspects of my life. But when it comes to healthcare, I don't want us to return to normal. I want us to be better than normal. And I think we can be better than normal in a variety of ways. I mean, we've seen with health equity, we need to do a better job taking care of our communities that are most vulnerable. And from a public health perspective, there's so much more we can do. We can be more accessible. I see the work that's been done through telehealth. We used to think about hospitals operating from 7 to 6 other than emergency services. We operate 24 hours a day right now for all services by using telehealth capabilities. I think about engagement and the way we're now, because of the visitor restrictions, we've totally transformed the way we engage families and friends and loved ones in the care of patients. So we've done so much work, and I think about preparedness. We're going to do so much more relative to being prepared when we think about pandemics of this mass proportion. So we're going to be better than normal, and we already are better than normal, quite frankly.
Yeah, with the number of COVID hospitalizations continuing to go down, the aftermath of this virus will be felt for a long time, particularly when it comes to mental health. And this morning you made a big announcement. Tell us about that.
Lisa, I'm so proud and I'm so pleased that we made this announcement. So I saw firsthand, I worked in Lower Manhattan in a hospital on 9/11, and I saw the destruction and the devastation, and one of the long-lasting effects was behavioral health and the impact it had on people as we reemerged from that tragedy. So I'm certain with COVID-19, with the impact it's had on so many families, so many people as individuals, just the very notion of being quarantined for this type of time period. Behavioral health is going to be an important issue, and what we've announced is we now have a 24-hour, 7-day-a-week behavioral health service up and running, free of charge to the community. Anybody can call it. It's 860-972-8100, and they will have access to a behavioral health professional who will listen, talk, provide them services, and ultimately align them with the best and most appropriate services should they need them. So this is really important, and we're going to stand it up for as long as it's necessary to be here for our community when it matters most, and we're going to be here to support everyone's emotional and behavioral health needs during this time period.
Yeah, it's been so tough on so many. All right, let's talk about testing now. How significant will testing be as we move forward into the next phase?
Testing is such a critical issue. First and foremost, it's what it means to each of us as an individual. So just within Hartford HealthCare, we now have 9 testing sites. We're a statewide network. It's from every county in the state effectively. But we're also using mobile testing and pop-up testing so that we can go to nursing homes and homeless shelters, community centers, churches, and a whole series of different types of communities and make sure testing is available. So there's no barriers to testing. It can be done free of charge today in many instances. If you call that same number, 860-972-8100, even without a physician order, we make arrangements to get people testing and provide that order. But why it's really important is it's going to allow us to monitor and really know real time what's the prevalence within the community. Are we seeing more people test positive, less people test positive? If they are testing positive, what age cohort, in what different setting, and then what type of measures can we take to protect the health and well-being of everyone in this process. So testing is critical to restarting Connecticut and to maintaining the health and safety of all of us.
All right, Jeffrey Flaks, thank you so much for bringing us up to date on your new world in the hospitals and Hartford HealthCare. Thank you very much for your time.
Oh, thanks so much, Lisa. Thank you.